Mental diseases is the topic today. I think one could wonder why we have decided to also have a lecture on mental diseases in a course which is mainly on neurobiology. This wouldn't have happened some 15, 20 years ago, at which time it was mainly the ideas that Freud was proposing that dominated the way that we looked at psychiatric disorders, at least partly. When I was still a medical student, the main treatment of psychiatric disorders was either electrotherapy, which has existed since the 1930s, a straitjacket, maybe, or a little bit of psychological counseling. This has changed dramatically to a very large extent during the past maybe 20, 25 years, mainly because of these guys. Medication is now dominating psychiatry, which has really been a revolution, a tremendous revolution, for good and bad, I think. One of the effects has been that the number of days spent at a psychiatrical ward or at a psychiatrical hospital has declined dramatically. So the main treatment of psychiatric disorders is now taking place locally. So people are living in their own homes or in a protected environment, whereas the need of actually having these psychiatric asylums where all doors have to be locked and where there's a lot of screaming and so on almost doesn't exist anymore. This is thanks to medication. It's a huge question whether it's a good or a bad thing. From a medical, doctoral perspective, it's a good thing. People are much more easy to handle. It's not necessarily what the patient organizations agree with, and much of the medication is described as sort of a chemical prison. And I mean, there are some discussions that can be made as regards to whether this is really a good way of treating the various diseases. Definitely from a medical perspective it is, but not everybody will agree with it. So what I'm going to talk about mainly is what are the biological foundations. Is it really neurobiological diseases, similar to any other disease of the brain that you could have? Or is it a psychological disorder which has nothing to do with the underlying biology? So one of the most common mental disorders is anxiety, which according to different people, almost all of us suffer from to some extent. We definitely all experience some kind of anxiety in relation to certain animals, and this is one of the arguments why many people believe that some kind of anxiety to some extent is innate, defined by our genes in one way or the other, and that the various ways of overexpressing anxiety is really just some of these genes going a little bit over the top. So that there is a lot of ways of dividing these anxiety disorders into different types. This is just some of them, but it could be divided into a lot of other types of anxiety disorders. But these are quite common and therefore also well described in the literature. So panic disorder is simply that some people under certain circumstances experience that they simply cannot cope with the present situation, and they go into a state of panic, even though it's not necessarily what other people would consider a situation which should require this kind of panic reaction. Very often it's possible to relate it to some kind of event which has happened in the past to that particular person. For instance, in relation to 9/11, there were quite a lot of Americans who didn't dare to take the subway because they were certain that there would be a terror attack, and many people would react with a panic if the place was too crowded and it was not possible to get out of the subway, etc. So that sort of panic disorder. Agoraphobia is basically a fear of going into an open space, like when there are lots of people outside. So again, people will also here decide to stay indoors and not go out into the open, which has unfortunately the result in the worst cases that some people decide to live their whole life indoors, receiving in some cases pizza through the mailbox and not going out with the garbage, which will then accumulate in their apartments, and at some point the neighbors usually begin complaining, and then the social authorities have to intervene. Obsessive compulsive disorder is actually also an anxiety disorder, even though to some it seems to be quite different from anxiety. These people don't react with anxiety as such, but it is anxiety which is the underlying disorder, and it's the obsessive compulsiveness is a way of coping with the anxiety. So it's basically people who have to turn back and make sure that the door was really locked, to check whether the lights were really off, which are all the sort of light versions which we all have to some extent. But for many of these it becomes really, really terrible. So some of them will, for instance, believe that they have bacteria on their hands, so they will be washing their hands repeatedly, several hundred times per day. So once they've washed their hands, they have to go out of the bathroom and they have to touch the door handle, go back and wash your hands, etc. So this is a huge problem for quite a lot of these people. Generalized anxiety disorder is anxiety, as it says, generalized, not anything specific, but just that people who experience day in and day out constantly an increased level of anxiety to basically just living. Social phobia is very, very common, and I think we all have it to some extent. The lightest version, I would say, is stage fever, the anxiety that you feel when you have to stand up in front of other people and actually say something. That's a light version of social phobia. When it becomes really, really bad, you can only cope with one or two people at the time. If there's more than one or two people in the room, you react by social phobia and don't want to be part of it. All the specific phobias, they come in all sorts of versions, and there are some fancy Latin names for most of them. I think the most exotic that I saw in, and it actually has a Latin name which I've forgotten right now, but the fear of having peanut butter stuck to the upper part of your mouth, which is actually a recognized anxiety disorder, and it has a Latin name for it. And apparently quite a lot of Americans suffer from it. So there are quite a lot of these specific phobias. Post-traumatic stress disorder is recognized now as a specific anxiety disorder, which is hugely common now after war experiences, but it also happens with more daily life traumas. If you lose a close relative, if you are part of a car accident, etc., quite a lot of people develop symptoms of post-traumatic stress disorder. So what is common to all of these disorders is that there is a heightened activity of the sympathetic nervous system. So it's simply people who has increased heart rate, increased blood pressure in general, chronically, because of this anxiety disorder.